Yes, I think we are now in December, so we are fairly confident that there will still be a few crises next year. And I think I keep coming back to this issue of donor fatigue and how it's affecting the ability to provide the services that the people in South Sudan require. I think in spite of the grim situation, I don't know, I'm always called an eternal optimist. There are still a lot of stories of resilience, of good things happening, people who have been able to overcome challenges. And I think we need to start telling more of those stories. If we are to get our partners interested again, everybody likes to associate with success. Right now, many people look and say, well, whatever money I put in, nothing is going to change. So why should I even bother? Let me take my money somewhere else. But if we start to share a lot more stories of good things happening on the ground, of progress that is being made, I think we'll pick up the interest again and get people to, start to work with us to support the country. Many times we think of, and many people outside think of South Sudan as one homogeneous basket case. But it's very different. Even just states alone, looking at states, the picture is very different. Go down to counties, Payams, Bomas. Let's work with those areas which we are seeing progress, push that progress, help them to spread their narrative about what they are doing. I think it will get us out of this, this doomsday picture that we usually, many people outside usually have of South Sudan.
Thank you very much. Tarian, please, over to you.
So from an access perspective, I think it's important in 2026 that we put people in need at the center of everything we do. Access, as many of you know, is not only humanitarians' ability to reach people, but people's ability to reach humanitarian assistance. And that needs to be at the center of what we do and in the center of what we advocate. Protecting humanitarian space is absolutely critical. And we need all actors, all sides, to be doing so. And that has to be something we, again, collectively advocate together for, but also in every engagement, that we're putting the humanitarian principles first and emphasizing these, that we will be reaching all people, regardless of affiliation or ethnicity or any of the other divisions that you see so many times in humanitarian contexts such as South Sudan, that we respond based on need, and that this is something that we lead with at all times. That we are able to operate independently. There has been some impediments on that, especially of late. And that is a concern for all humanitarians. So for us to be able to put people in the center, these are all the things that need to be in place, and this is what we need to work together on, but also that the government, opposition actors, etc., all understand this and understand that they are in a position to be able to create these structures, enable, ensure that the environment is enabling for us to be able to reach people in need.
Thank you very much. Sylvia, may I come to you next, please?
It's working? Yes. So how to challenge the normalization? And I think the first thing is to encourage all partners in the field to keep gathering information, and I think it's great to see that MSF has launched this report. So gather information on the consequences of these normalizations and on the risk that it has. I think that the spirit that we all have when we do humanitarian is still to get outraged when you see that some lives are lost for preventable causes and sometimes because of lack of access. So I think that spirit of not normalizing and keeping that strong outreach, it's important to advocate and to call for action. And then call for action, as everyone is saying. It means that, yes, attention to the crisis and to those most in need, but also to the government to step in and take over on their responsibilities, and in terms of access, as Terian was saying. And then I think that we said before, there's going to be compromises on trades-off, so I think it's very important to also keep monitoring and looking at those signals of deterioration, so that even if efforts continue in terms of durable solutions, in terms of strengthening health systems, still the humanitarian system and the humanitarian sector remains very much agile in terms of detecting those alerts and being able to respond.
Thank you so much, Sylvia. And for the final word, I pass to you, Sigi, please.
Thank you very much. Challenging the normalization of the crisis in 2026. As I said at the beginning, when I look back in the years before, I saw already 2025 a huge deterioration of the situation in South Sudan. And I guess we need really to focus to put this on the tables of the discussion, to bring it to the attention of the national medias, of the international medias, of the national community, international community, not to let it go and say this is a normality. Because it's true, in South Sudan we have managed challenges, and as the human being is a bit like this, trying to normalize the craziness, we are also a bit in this trap. Huh? So really, that we think this is a normal situation, but it is not. It is definitely not. Once again, the key points, attacks on healthcare facilities all over the country, where the conflict areas, this is not normal. This is not the normality that we should face. Terian pointed it out very right. There are a lot of challenges in South Sudan, and we really have to put it on the table, and I'm very glad that MSF put this report now. It's a discussion part. It's a starting point, also a discussion. We know we have it all over. We had the health summit last week, where also the MOH and all the stakeholders were discussing the problem. But it's really also important to keep the donor community responsible for South Sudan's continuation support for the population of South Sudan, but as once again also said, the government of South Sudan responsible for their own role. And I like this, we should also tell success stories, it's true. And I remember 2013, I was first time in South Sudan, the capacity of the national staff was not there. We didn't have so much healthcare workers, also educated healthcare workers. Now we see in MOH facilities, we have national colleagues who are well educated. So we have also telling these stories, not only the negative stories, but the problem is the healthcare workers are not. So to keep up the motivation is another part, but we have also to see there is a development, there is positive success in the country, but with the current deterioration, we are aiming in the direction to destroy this access, these success stories. So really we have to keep South Sudan on top of the discussions and the communication. And so I'm happy that we had the chance today as well.
Thank you very much, Sigi, and thank you very much for the author of the report, Liam, for putting together all this information, and for all the MSF teams who have been working very hard to provide medical care in tough conditions, and to all of our fellow humanitarian colleagues, thank you. And to the population of South Sudan, we're here with you, we stand by your sides. We want you to be heard. Your voices are important. There are many of them collected in this report. Please have a read. They deserve to have their stories be told and to have their needs put first and foremost. So thank you for also noting that, Terian. The people at the center is the way forward. One more thing to note, if there are any requests from the media or any follow-up you would like, we have the other sections of MSF also present here for follow-up on Opengek, for instance, or any other questions you may have. Feel free to contact Sasha. She's back there in the back. Hello, Sasha. She's our field communications manager. You can reach out to her for anything that you may need. And of course, we're always available to anyone who has any questions. Thank you for your time and for your attention on this important report. Thanks to our panelists. We'll also have some refreshments, so please do stay, help yourself, and thank you very much again.